of the meat packaging industry, we are mostly consistent about immigrant workers.
Estamos aquí más que nada arriesgándonos también a muchas cosas que están desconocidas como el idioma que nosotros no conocemos.
Migrant worker women have been coming from central Mexico to the eastern shore of Maryland to pick crab meat since the late 1980s.
The protein processing industry is a major economic force in our county. We rely heavily on the seafood industry and therefore the crab pickers and H-2B workers. And then on the northern end of the county, it's a big poultry center.
When the COVID started, this is one of the points that we have many infections because the people, more of the community works on the poultry plants. So the people inside the plants, they have many problems with the COVID.
The challenges that the Haitian community are facing during the pandemic, there were a lot of miscommunication and then the workers didn't know exactly what to do.
Al principio yo creí que no, o sea que no existía el virus, creí que a lo mejor era algo de los políticos.
At the beginning of the pandemic, they had nothing. The company refused to spend money on any PPE. They refused to put in more washing stations. People around me that I hugged the day before passed away 3 days later.
Y si arriesgamos eso, nuestra salud también, por este COVID-19 que está a la vista todavía, es por sacar nuestras familias adelante.
We had initially applied for some funding for work involving the crab pickers on the Eastern Shore, and the CDC really came back to us and said, this is important for protein processing workers, more broadly. And so we partnered with some of our long-term partners and some new partners like the UFCW, Local 27, Rebirth, a Haitian American community organization, CATA, and a number of other organizations to build a coalition in order to ensure that those workers had access to easy to understand information about COVID-19, about how they could protect themselves, and about their rights.
It gives us the opportunity to bring focus to the issues of the workers across the states in a national spectrum.
One of the key pieces of this project is that we want to provide evidence-based information to our protein processing workers. In essence, we're not only doing it in a language that the workers understand, we're doing it in a way that the workers understand.
When the pandemic hit, we already had a pretty strong following on contratados.org. We had launched the platform in 2014, which is a Yelp for migrant workers. We also use tools like Sol, which is a bot that answers workers' questions. We also use tools like WhatsApp, Facebook Live, YouTube, and other channels to reach workers in real time with information about their rights in the context of COVID-19.
Bueno, la diferencia es mucha porque en otro lugar podemos como tener demasiada información y no sabemos si es verídica.
One of the really unique things about this project is the role of the Worker Advisory Committee. And so the Worker Advisory Committee is a group of workers from different protein processing industries, from different language and in different backgrounds, who are advising the project in a number of ways, really ensuring that the strategies and the messages are accessible to workers and really meet the needs of the community.
Hacemos aportaciones en general todas las compañeras de la experiencia que ha tenido cada una. Bueno, yo al comité he aportado lo que yo he conocido de mi trabajo, de mi experiencia.
Dorchester County Health Department has greatly benefited from partnerships with CDM and UFCW, not only with boosting our vaccine coverage, but building trust in the community.
So we also reached workers with information through in-person outreach and community events with our partners.
So when we have these events and we have these organizations come out and give out their information, it's helping everybody know where everybody's at and to let them know that they're not alone.
program has helped us bring together the community-based help to the communities that need the help.
In the first year of the PPP project alone, we were able to reach more than 20,000 workers and community members through in-person events, and also reached hundreds of thousands of additional workers through 160 online or digital events or resources. After the first year and the success of the first year, we decided to expand the project to North Carolina, South Carolina, and Georgia to really reach larger numbers of protein processing workers in the region. In the crab industry in Maryland, 100% of the workers are vaccinated, and there's been not one death in that industry. And we're really proud of that because we've played a key role in ensuring that workers had accurate information about the vaccine, about COVID-19, and were able to get answers to the questions that they had.
The people who are partners with CDM are working on the ground with people involved and bring voice when they say, that's not actually how it plays out though. Here's the barrier, here's the challenge.
So we've learned a lot in our response to the pandemic. And one of the main things that we've learned is that worker health is public health. And it's certainly a lesson that we need to take with us beyond the pandemic to ensure that our public health institutions prioritize worker health.
The partnerships we've made along the way and the spotlight on the health disparities that exist really helped us to develop an infrastructure, a sustainable infrastructure of community partners and strategies that will help us move forward and really unify our community and its health.